So, Aaron, are you the lone wolf at Camp Lejeune now?
Yep, I'm the one and only.
That's all right. They just stole Nick from me.
Yep. And I guess Jeff's leaving, so he won't be coming back for a while. So,
Oh, I doubt that. I mean, this is 10 times the size of Lahaina.
yeah.
The task order's for like 12,000 homes.
Yep. Yep. And the terrain's a lot different, isn't it?
What's that?
I says the terrain's going to be a lot different than what they had in Hawaii. I know it's mountains and hills, right? Or not
And
necessarily mountains.
it's kind of the same because it's close to the water, at least in some of the areas. So we'll see.
Yeah.
It's just different rules in California.
Yeah. Well,
So,
you know, breathing oxygen will cause cancer in California. So,
well, it's our home base.
yeah.
I know Paul's there. August is there. The whole Lahaina team is basically there, or they're
Yeah.
going to be.
Gonna be, yeah. Yeah, we're moving along here at Camp Lejeune though. So
It's still the water
and we got
treatment plant.
another. Yep, yep. I think shooting for October or somewhere in there.
All right, I got 10:59, so I don't think we're going to get anybody else. It's been the same three that have been on since the beginning. So, um, I think most of you, well, I know Aaron knows me. We've worked together before. Ernie, I know that I may have spoken with you before because I had all my clearances done for CNL and then I got pulled off to other things.
Yes, yes, we have
So
spoken.
so I have been up there. And Jock, I don't know if we know each other at all. So good to have everybody. What we're going to talk about today is injury case management. This is something I've had in my bag of tricks for a while, and it was really originally designed for safety people, but also with the intent of being able to transfer this to a lot of our subcontractors who don't have any clue about the OSHA rules, regulations, and those kind of things. We've seen it extensively when we've done these emergencies. So we'll start from the beginning. Um, what I want to accomplish today, obviously, this is you folks know this. Ernie might be a little bit different. Your rules are different up in Canada. Kind of the same, but just it's different in how things are recorded and those kind of things. So you might want to get into that a little bit and enlighten us as we go through this. But just understanding what a first aid is, what recordables are, look out for those hidden recordables. Recognize what over-the-counter and RX strength medications are. This is typically what can get us to a recordable that's not necessary if we manage it properly. What to look for in case management, what are our incident reporting requirements, and then we'll go through a couple of case studies and I'll just open it up for any experiences you guys have had with injuries recently. I know I've had a few between Lahaina and now here. First aid examples, a non-prescription medication at non-prescription strength dose. And the average like ibuprofen taken at the regular dosages is usually the big example, or neoproxen with the other ones. Tetanus shots technically are not. Cleaning, flushing, soaking surface wounds, wound coverings, butterfly bandages, steri strips. The one that slips in here, though, is if they do use glue, it becomes recordable. So we try to keep people away from that and keep them to the steri strips if we can. But managing medical people is difficult at times. Hot or cold therapy. The example there mainly would be heat stress or cold exposure hypothermia. Non-rigid means of support and any kind of temporary immobilization device used to transport. Typically, that's when they're thinking somebody might have a spinal injury and they're gonna secure the neck, put them on a flat vest board, and those kind of things is where you see that. Other examples: drilling a fingernail or toenail to drain fluid from a blister. Eye patches, but this one's kind of usually when you get an eye patch, you got some kind of restriction that goes with it from what you're doing. I don't see office people might be okay with this, but most of our construction workers in the field would not be. Taking foreign bodies out of the eye with only irrigation or cotton swab. The trick was always to have one of those little metal stringies that could take it out, but that puts it in recordable category. Removing splinter or foreign material from others other than the eye by irrigation, tweezers, cotton swabs, or simple means. Finger guards, massages, and drinking fluids to relieve heat stress are other examples. Recordable, death. That's one you don't ever want to go through, but I've gone through it at least 3 times in my career. Days away from work. This is typically what we see sometimes. We try to manage these to restricted cases. It doesn't always work, but restricted work activity, I mean, that routine job functions are defined as work activities that the employee performs at least once per week. Kind of a wide open terminology, but basically, if you got to take them from being an operator down to being something on the ground or put them in an office work kind of thing, it's going to be restricted. If you got to transfer jobs, they're going to be, if they got to go sit in the office and they're a carpenter, that's kind of what you see. But we can manage them from lost times, which we don't want if we can avoid them. Medical treatment beyond fate, first aid, obviously. That includes stitches, fractures, any broken bone. And remember, Aaron, we had one at Camp Lejeune where we had a broken tooth, which is technically they consider it the same as a broken bone. So that goes in there. Rigid splints, loss of consciousness, which is kind of hard unless you've got a witness to see. Somebody may or may not know if they lost consciousness. Or significant injury or illness diagnosed by a physician or other licensed healthcare professional. You'll see that term used. PHHCP. Common misconceptions about what OSHA means by work-related. Saying that the employee was not engaged in work activities. That's called the geographic presumption. That does not always work. Okay. Employees not supposed to be doing what they were. Technically, they are under our control. So if they're under our control, it's considered work-related. And then just sitting, well, this couldn't have been prevented, so we're not going to count it. That doesn't work either. Employee failing a drug test. Used to be if they failed a drug test, you could go away with it. And if, for example, individuals get in a fight resulting in recordable injuries, you could do that as unforeseen employee misconduct, but that went out the window about 20 years ago. Could have happened anywhere. That's thinking that, man, might probably happened at home, but they don't know. They can't tell us. These are the ones we really got to manage closely and really good investigation to see how this could have happened or how it happened. Employee not on the clock. The only ones I can remember seeing in there is they used to have the exemptions, like if you were making your lunch and you cut yourself, trying to get something cut up. I mean, that wasn't one. If there's no witness, if we don't have a witness, what can we say? The employee waited too long to report the injury. Now, this one gets you down into comp law because most states, an individual can report an incident, an injury, up to 2 years. And in one case, I think New York is still 3 years to file a comp claim. So people can virtually keep reporting at any time. Anytime someone needs medical attention offsite, obviously get your senior safety involved, your senior management involved. I've had situations on larger jobs in my career where on-site medical can actually create recordable injuries where they really don't need to, and that comes down to the training of the nurses and the licensed healthcare physicians that you bring on site for bigger jobs. Physicians' medical notes are the law. You really can't get around them. You can sometimes get them to change the wording, but you got to act quickly. And unfortunately for us, we're construction managing most of the time, so we don't have a lot of direct hires. So this becomes even more difficult when we're dealing with our subcontractors because they are technically the employer. and that's how the laws are written. So they basically got to make these things happen. So in that role, we have to coach them into the right way to get this done. That's why this is a good presentation. If you need it done for some of your contractors, we can get. I can do it. Nick can do it. Kim can do it. Um, and this is another one too. You want to get the return to work form if you can. Don't rely on word of mouth. Uh, some of the testing procedures for diagnoses don't impact recordability. The example is an X-ray where there's no break, an MRI where there's no findings, a bone scan, or if they're staining the eye to see if there's any damage. Those things do not or cannot. They can, but they can also go the other way. Hidden recordables, over-the-counter meds, given a prescription strength, like 800 milligrams of ibuprofen every 4 hours. We're going to see some levels below that. That's really where we hit the line. Return to work, but where a brace is needed. As long as it's a soft brace, that's okay. And as long as they can work within those restrictions, it's okay. But then you get back to restriction, maybe a recordable. Here's some of the strengths that you can't exceed. So ibuprofen or Advil, 467 milligrams, Benadryl, 50, naproxen, which is what is in the leave, at 220, and ketoprofen at 25 milligrams. Typically, you don't see that prescribed, though, or given. Case management, what to look for. May return as scheduled. You got to be very careful about not having time off with this. It could result in a lost time case. So if we see that kind of language, we want to get our more senior people involved so we can help manage the case. As needed is any reference to taking medicine as needed is what you want to see versus prescribed frequencies. And as tolerated, a lot of times this is, if you're going to operate equipment and they're giving you something that's going to make you a little woozy, that doesn't fly. Incident notifications, I think everybody's pretty familiar, but we have our client related notifications that are usually outlined in the health and safety plan or the APP. But as far as ECC, we want to make sure direct supervisors are notified, and then we start coming up the chain. Project managers, supervisors are notified, the respective operations leads, safety network, and if needed, the workers' comp department as soon as reasonably possible, but within 4 hours. Senior functional leads above the project level are responsible for verbal notifications up their respective chains, up to the CEO. Serious injury or notifications, these are the ones that OSHA defines as needing notification to OSHA itself. Inpatient hospitalization, this one used to say 3 or more, but it changed a few years back to any overnight hospitalization. Amputations became big. So like if you lose a fingertip, we've got to notify OSHA. Eyes also. These were like the big three. And obviously, we've got our chain that needs to be reported to, and Kim, as the corporate safety director, needs to know, obviously, and then up to Monjeev and some of the other folks like August, Bud. And we could do a separate course on this, but putting the incident in the EcoNext not always the easiest thing to do if you've had to do it. It can be a little arduous, so you got to go through the process. I just went through one where we put it in, and I actually had the project manager with me and everybody else when we filled it out because it gets very detailed in EcoNet. Serious injury notifications. Obviously, we got to report to OSHA within 8 hours of any fatalities. Inpatients within 24 hours. This is pretty much going to happen by the corporate EHS director. She may designate one or two other individuals at this point, but that's typically one you want to make at the highest level. Okay. Any questions so far? Everybody still with me?
still with you.
Still here.
All right.
Yeah, I got you, Bob.
All right. Okay. Here's the first scenario. Employee bumps into a bolt, resulting in a minor laceration to her lower leg that requires medical treatment. She has a personal blood condition that prevented the blood from clotting as quickly as it should. The physician uses steri strips to close the wound and instructs the employee not to return to work for 5 days to allow her personal blood condition to stabilize. The employee's own doctor stated that absent the anticoagulant condition, I gotta know pronounce that one right, the employee would have been able to return to work. Is this a recordable case?
In Canada, I'd say yes.
Okay. It
And
would be the same. It would be the same in the United States because it's the event that caused the injury, not the blood condition itself. It's the event that did that. So this would be recordable. If these symptoms started at work, obviously it's going to be recordable. If the lacerations were not a sign or symptom of pre-existing conditions, it was the injury that caused the event at work. Okay, the fact that the employee might have immediate days away to recover from laceration had she not had a pre-existing condition that prevented blood from clotting as quickly as it should does not change the outcome. Okay, so that's a little technical one. Next one, this actually happened in Lahaina. Uh, One of our big boys got hit by an excavator bucket. If you were have ever done fires and stuff like that, there's very tight areas when you're on somebody's piece of property. So you got to be very careful, and you usually got mini excavators and bigger excavators. In this case, he got in the way, and the excavator bucket, the operator didn't see him and just basically launched him probably about 10, 15 feet. He shook it off, was like, I'm good to go. And then later on that night, he started getting pain, and he went to the emergency room, didn't even notify his employer. He got pain relievers and muscle relaxers and says he can return to work the next day. The return to work also includes a note that the return to work is predicated on being able to sit most of the day. Is this case recordable?
Yes.
You are correct.
it is yes.
Yeah, it's because of the prescription meds and the restricted duty. Okay, so those are two things that would either one would have made it recordable. The fact that he didn't report it doesn't matter. Okay, these are the ones that we got to try to manage. We let this one get away from us. So, all right, anybody got any ones they want to discuss that's happened recently to you? I mean, we've had here two here at McDill. We had one that I would say was caused by an unsafe condition. Um, it's a ladder way up to the back of a semi that's parked. One side of the railings they put in correctly. The other side they were missing a nut and bolt, so they put a screw into the railing. And when somebody leaned on it coming down, it failed, and he fell to the ground and dislocated his elbow. But that would be more of a condition. We also had a pretty healthy cut on the left thumb of one of our individuals that was scraping up carpet glue residue and basically had this. It's an 8-inch scraper. It probably can expand out about 6 foot. And he was standing up and he slipped and his hand basically went right onto the blade, resulting in a significant laceration. It was 20 stitches. He was very lucky. Didn't cut through any muscle or any tendons. When I first looked at it, I was like, we called an ambulance right away on that one. So that's my last two. Anybody got any to share? All right
Not
then.
not no not over here, Bob. We've been pretty lucky on the Moody side to not have to have any of those incidents.
That says you got Lewis as your guardian angel, right?
That's right.
As long as he stays inside. Okay. Well, that's kind of all I had. We've gone through a lot of things. We can always expand on this for subcontractors. I think the other one that can go into this is, you know, there's an EcoNet um, incident management presentation that you can go through to go through EcoNet. But my experience with that, and even stuff like the management safety inspections now, is it's much easier to kind of go through what our rules and regulations are, and then take them live into doing one of those incidents or management inspections. So if nobody's got any questions, I know it was kind of quick and dirty, but this is one of those ones that we can get to our subs fairly quickly. You give them a better idea of why we need to manage and what's it all about. So I appreciate your time.
Thanks, Bob.
All right. Thank you.
Thank you.
Thanks, Bob.
Thank you.
All right.
All right, everyone, stay safe.
Thanks, Sally.